way. I take the pleasure to welcome all of us on this echo session for the month of July. I know you always attend the sessions. This time around, it's going to be a little different. We are going to be going through the assessment tool. There is a viral load program assessment tool that LabCoP developed with inputs from a number of stakeholders. This is the same tool that we used last year around almost the same time. So we want to see what has happened ever since last year around the same time when we did an assessment. We are doing it again to see if there have been any improvement, if we have gone down or we have remained where we are. All that needs to be tracked so that we understand the factors behind the performance as of now as compared to what it was last year, because we aim to track how we are progressing. And this self-assessment process is not kind of an audit. It's not like an audit. We are not like coming around to say you're doing bad or this one is doing good, or to kind of judge your performance. But basically the tool is helping you from within to understand how your program is, and if there are gaps, to see how these gaps can be addressed. And we can use the same tool to advocate from within, within the country stakeholders, but also outside the country. And we also use the same results of the assessment to also advocate for you through the different stakeholders, your stakeholders who may be in country and those that are out of the country. You remember the assessment that we did before the face-to-face meeting was the basis of the focus that we had to have during the face-to-face meeting, because it gave us an idea of where country programs are. And that's when we chose demand creation and results utilization as major gaps, though there were other gaps around network optimization, waste management, and so on. Those have been our focus, but the results came out of the country assessment. So even this time around, we want you to use the tool to assess yourself objectively. Don't overscore yourself so that you appear good when things are not good. Just report it the way it is. We have two presenters today. We have Getachew Kassa from ICAP. Is one of ICAP is providing technical assistance to LabCoP. So Gesh is an expert on M&E systems, and is our sub. So he's going to be highlighting the key thematic areas of the assessment, and also guiding on how to do the self-assessment. Then after that, we will get a country experience from Zimbabwe. Zimbabwe has attempted to actually fill the assessment tool, and they will be actually sharing their experience, and then we shall also learn from that experience as they grappled with the process of filling the tool. It was a learning experience for them. I know they will go at it again after today's presentation, but the preliminary work they did will be a great insight to the rest of us. So we are doing this because we are planning to have another face-to-face meeting, which is happening in October again. We will be sending shortly, we'll be sending a save the date, and we will be giving you more information about the face-to-face meeting. It will be happening in October from the 15th up to 17th of October. And it will be in Addis Ababa, where you will be coming to present the assessments or for us to know how the programs are and where the challenges are. And then we chart a way forward together as we did in the last face-to-face meeting. So I will not take a lot of time now. I will give the session, I'll hand over the session to our subject matter expert, Dr. Gesh, who is going to do the first presentation. And then Norah from Zimbabwe will do the second presentation. So Dr. Gesh, you are welcome. Hello. So remember to register yourself, use the chat box to register your connection. If you are more than one, you register all the people that are with you at that same connection. But if you have a question, use the chat, put in your questions. Somebody will be tracking the questions, and we shall have them answered towards the end of the session. But also, hello, Gesh? Gesh, you need to, Gesh is our first presenter. Okay, so if you are not speaking, you mute yourself. That will help not to interrupt the session. So Dr. Gesh, you're welcome.
Hello, can you hear me now?
We hear you.
Oh, good. I was just checking. Thank you. Thank you, Charles, for the introduction. So I'll try to summarize the key points that help to complete the viral load test assessment scorecard, and hopefully next presentation from Zimbabwe from the practical experience of completing the tool. So my presentation outline looks like this. I will have a brief introduction, and I'll take you through the domains of the assessment tool. And finally, we will close this session by providing some next steps. So before I start my presentation, I just that we presented and introduced the LabCoP assessment tool last year, and all the 11 member countries completed the tool and they analyzed the data. So the data were helpful in developing the country during the face-to-face meeting in Kampala, Uganda last year. Now we need the country to complete the assessment tool with a better understanding subjectivity, so the country can check the progress of the viral load scale-up after various efforts in a year. So today's session is just to highlight the gaps we identified last year in completing the tool and improve the reliability of the data, so that it will be informative for further improvement in coverage as well as the quality of viral load testing services. Having said that, this is just a rapid assessment of national laboratory system supporting HIV viral load test in countries participating in the LabCoP project. So it will really help to identify strengths and weakness of the laboratory system to support viral load scale-up, and it will also help to monitor degree of improvement we believe that country team can also use this tool for regular monitoring of the progress. So it also help countries to focus their resources on identified gaps, and partners can collaborate with key stakeholders based on the gaps from the assessment. So there are few points that the country team need to consider in completing the tool. Country team and have an existing assessment tool for the general laboratory system or for the viral load testing scale-up. And this is not to duplicate efforts or to create a parallel monitoring system. Rather, it is just to complement the existing efforts. So as I mentioned in the beginning, the most important aspect in completing the tool is reliable data, and it shouldn't be just for assessment exercise, rather getting information for improvement. So there is a need to identify and choose appropriate data from the national report or data from different registers, but it should be really accurate and reliable so that we can use that data for improvement. And at the end of the analysis, we also expect country team to share information about of the country on viral load testing for possible support by partners and donors. So in order to have reliable data and accurate data, the team needs to carefully read and understand the questions first, and members need to discuss and reach on consensus. It shouldn't be only one person completing this assessment tool. Rather, the team need to work together and collect the data. And so that they need to also reach on consensus, because some of the questions are a little bit subjective. So if more than one person can able to collect the data and discuss on it, it would be very reliable. All the questions are referring to get representative information on the national system, not on a single site or district. It should be the whole national system. And in some cases, when there is no reliable data for the don't get annual data, probably they need to consider data could be a quarterly report or semi-annual report. The data source, it depends on the country, but they can also check from the National HIV AIDS Prevention and Control Unit at the Ministry of Health if they have annual report, and it could be from the National Reference Laboratory Center, or it could be from partner reports. So they need to check all these sources and get reliable data. This is the assessment tool. I'm sure all of you know this tool because you already used last year to assess the viral load scale-up status in your country. So the assessment tool is designed with capability maturity model, and the tool helps to assess the current viral load scale-up status and support figuring out what capabilities of the country need to acquire next in order to improve quality and performance, as well as system strengthening. So the first column, as you can see, it is the list of questions under each domain. There are 7 domains, starting from demand creation based on the viral load test cascade. So the questions are arranged in such a way it starts from the general laboratory system, and it will go to the specific viral load testing cascade. For instance, under demand creation, as you can see, it is checking whether there is a national strategy or procedure to increase demand of specialized or newly introduced laboratory tests. It's not specific to viral load test. So it starts from the general laboratory system to the specific viral load test. And the other columns, as you can see, it is arranged from orange to deep green. And the orange part, or level 1, that one is the lowest score. That indicates that there is no system, there is no strategy, or there is no initiative. It depends on the question. Level 2, the yellow part, there are initiatives or guidelines or strategies, but it's not fully operationalized. Or the strategy is just implemented in a very few sites. So in that case, you have to circle or label number 2. In case of number 3 or level 3, this is the guiding protocols, strategies are there, but there is a need to improve more. Probably most of the facilities are implementing the strategy or utilizing a guideline, but it may not be in all the facilities. But in level 4, that is saturation or the capacity of laboratories achieved their goal, and they're on maintaining the achievement by having regular monitoring and those things. So in that case, you can use level 4 to score your capacity or your achievement. So these are the domains of the assessment tool. It is just based on the viral load test cascade. The start is from demand creation. The second one is specimen collection and processing, sample transportation and referral linkage, and HIV viral load testing. Under HIV viral load testing, there are sub-domains. It includes quality management system and standards, and waste management and biosafety, supply chain management, and equipment maintenance. So under the viral load testing, there are subtopics that's addressed in the assessment tool. And result utilization is the 5th domain, and leadership and management also the 6th one. The last one, national data on viral load testing and ART. As most of you remember, last year, all the 11 member countries completed the assessment tool, but most of them couldn't complete the last domain, that is on the national data. But that one is also very critical because it helps for objective evaluation of the viral load scale up in the country. So we want you to focus on that domain this year, and we want every country team to complete all the domains, and so that we can able to identify the gaps and scale up the strong side of the efforts in the country. So we want you to complete all the domains. So under demand creation, I already explained a little bit, and under number 2, it is the specimen collection and processing. As you can see from the questions, there are 3 different questions, and it addresses availability and use of guidelines or protocols on specimen collection and processing, system on monitoring sample rejection rates, and it also asks the average of the specimen rejection rate at national level. You don't have to include the rejection rate of 2 or 3 sites. It should be representative because we are focusing the national system. In order to have a representative data, you need to have more number of sites. If possible, all the viral load testing sites. If you just include all that, it would be a very good and reliable data. So under number 3, it is sample transportation and referral linkage, and it are the questions address whether there is available national integrated sample referral network, or if there is a well-organized system for sample transport, sample integrity, and the other most important question is turnaround time, which is really one of the critical indicator to check the effect of the country on viral load scale-up. So if possible, the countries can have a disaggregated turnaround time, but in this case, we're just asking from sample collection to delivery of test results to the clinic. So they can disaggregate this one into 3 or 2 if possible. Otherwise, you need to complete this one properly. So under HIV viral load testing, as I explained before, there are sub-domains, but as you can see from this, it checks if quality management system is part of the national program and its implementation, and if all viral load testing labs slipped audited or with other standards, viral load testing labs enrolled into external quality assessment scheme, and if there is availability of SOP or proper utilization of SOP and guiding protocols. And there are many questions. I don't want to spend more time on this. So these are the main domain that we want you to work more this year, and so that we can calculate viral load testing laboratories and different patient outcomes. So we want you to complete this one. I think it would be more easier, or it would be more clear when the Zimbabwe team present the practical experience they had when they complete the assessment tool. But just to mention some indicators, for instance, the first one, number of laboratories currently carrying out HIV viral load testing. I think that one is list of companies, if there is national reagent and rental agreement, that's also very clear. Total done in the last 12 months. Probably if we don't have data for the last 12 months, probably the report in 18, at least for 1 year. If that is not also possible, try your best to get data for the last 2 quarters or report. And the next indicator is capacity of national viral load test labs. In that case, you need to consider the type and number of machines in each viral load testing labs, and you have to also consider working hours of the labs, and you have to also refer information from the manufacturer of each machine on the capacity, capacity of the machine processing tests. So you calculate the total capacity of the national viral load testing labs. The others, like people living with HIV currently, I think that's straightforward, and you can just refer. Any question, definitely you can ask, and we can also discuss at the end of the presentation if you have any specific question on the indicators. I'm sure most of you referred the viral load result utilization recipe. All these indicators are included there, and if you need more clarification, you can also refer that recipe or cookbook, which is posted on LabCoP website. So as the next step, the country team needs to identify the people collecting the data, and they need to also discuss and on consensus after collected the data. And you guys also analyze the result. Of course, we'll help on that, and identify the key gaps and prioritize the intervention, share the results with the stakeholders, because it is not just for collecting data and appreciating the gap. Rather, we need to use that information to work with partners as well as key stakeholders for improvement. So these are the next steps. Thank you very much. And if you have any specific question, definitely we can discuss. Thank you, Charles. Back to you.
Thank you, Gesh. Yes, thank you for that presentation. The questions, keep them, just keep pushing them into the chat box, as I call our next speaker, who is Norah, the lab scientist from Zimbabwe, who is going to give us their experience. They tried to fill the tool, and then they want to share their experience with us so that we gain more confidence to fill the tool. Norah, you're going to share your slides, okay? So there you are. So Norah, I give the floor to you. Hello, Norah. Welcome. Okay.
And good afternoon to everyone. On behalf of the Zimbabwe team, I'm going to share our experience completing the viral load self-assessment using the LabCoP scorecard. So just to mention that we had the ASLM team in country a few weeks ago, and we did discuss with the ASLM team and to get some clarifications on some of the questions that appear on the scorecard. So just to give you a bit of our country context, as Zimbabwe, we are one of the countries in the world that are heavily burdened by HIV and TB. We have an estimated 1.3 million people living with HIV, the majority of whom are adults. We have an estimated 1.25 million adults living with HIV, and then about 76,000 children. Our HIV prevalence is at 13.7% among the 15 to 49-year age group. Female HIV incidence is slightly higher at 16.7%, compared to males at 10.5%. Our incidence is 0.48% in 2016, and just to note that this has been going down. Mother-to-child transmission rate is about 6.7%, and TB HIV co-infectivity rate is around 63%. Provision of art services was decentralized, and we have 1,578 health facilities that are offering art across the country. In terms of viral load testing, like most African countries, we started with targeted viral load testing and moved towards universal coverage in 2016. We started off with one viral load testing lab, and we have expanded to 14 labs between then and 2018. The map on the right is just showing the distribution of the testing labs, with the green rectangles indicating where conventional testing takes place. The yellow ones indicate a point of care sites. So in terms of coverage, like I mentioned, we started with targeted testing in 2015 with a coverage of about 6%. And as of 2018, it had gone up to 45%. So in terms of tracking the country progress, we have an M&E system that is in place to constantly monitor how the program is performing. Additionally, there is also need for tools to rapidly assess our national lab systems to identify strengths and weaknesses for continual improvement. And one of the tools that can be used is the LabCoP viral load scorecard, which we started using it last year, like most of the countries on this call. And this year, we have started the process of completing the scorecard again. So this is the scorecard. I will not spend much time on it because Getachew has already described how it works. So in terms of our experience in filling out the viral load scorecard, firstly, you want to know who should be part of the team in order for a country to be able to complete the viral load scorecard. As you have heard from Gesh, it has 7 domains and it covers the whole viral load cascade from demand creation, identification of the patients, all the way up to result utilization and M&E systems. So in order to be able to complete the scorecard, you need to have all these people involved in all the different aspects in one room and actually check progress, looking at what has been done and where people are. So in our case, we discovered that we needed to have people from the HIV program, and this includes the M&E team as well, because some of the data you actually get it from the M&E team. You want the national lab people to be there. You also want the implementing partners, both lab and clinical, and also civil society. In terms of sources of data, you are looking at the program reports that are done monthly or quarterly, semi-annually or annually, depending on what the system is. And then in our case, we also have a lab information management system. You get some data from there, manual registers, and DHIS too. In terms of agreement on the final score, you realize that different stakeholders may have a different interpretation of the domain questions and scoring. So it's important to have consensus on meaning of questions and objective scoring based on laid out criteria. I put the word objective in bold because initially when we went through it, we were not as objective. And you realize that you end up scoring mostly greens, but when you then go back to the questions and reread them carefully and try to be objective, for example, if a question is saying less than 50% or greater than 50%, if you are not very objective, it's easy to say, oh, most of our sites are doing this, but when you actually start counting the numbers, you may realize that it's not actually the case. And then in terms of domains that were more challenging to fill and why, I would say in our experience, we had domain 7, which compiles information about the national data on viral load testing and art. And then domain 2 as well, specimen collection and training. The reasons why these 2 domains were challenging was that for domain 7, we had missing data because of inadequate reasons for tracking patients longitudinally, so that we can separate their questions that are routine and repeat viral testing. In our system, it's a bit difficult for us to to determine which one was repeat, which one was routine, because of the way our M&E system is designed. And then we also had inadequate data regarding virally suppressed patients, referred to lesser intense models of care. Again, the current M&E system is not capturing that, so it was a challenge. And then for domain 2, under specimen collection and training, what we found most challenging was that it actually includes all tests, not just a viral load or EID. Even though this scorecard is talking about viral load, section 2, it's asking for data regarding all the tests that the lab system is handling. And in our case for viral load EID, if you just consider viral load, it will be mostly green, but once you consider all the other tests that the lab system is handling, the scenario is a bit different. Also because viral load is a bit more centralized than the other tests like your hematology or chemistries. These are being done at a district level. So now trying to combine everything was a bit challenging. So this is examples or screenshots from the assessment that we have done. Like Charles and Ash indicated, we have been working on it for some time now. So, but we are happy to share what we have done so far. So under demand creation, we do have, in terms of 1.1, is there a national strategy procedure to increase demand of specialized or newly introduced lab tests by clinicians and clients at healthcare facilities? We ended up with a score of 2, which is yellow, and our explanation or justification was that while these SOPs are in place, the distribution and implementation will need to be scaled up to all the facilities. And again, the second one is on yellow. Then the national initiative strategy that engaged stakeholders, we had a green. We felt that we had engaged most stakeholders that are involved in these activities. And in terms of training or orientation for clinicians, we also felt that they are trained and orientations have been done across all the provinces, but the ordering part is still needs to be improved. And this is based on the fact that our coverage is still not where we would have wanted to be. So the coverage still needs to be increased. And then specimen collection, like I mentioned earlier, looking at viral load, it will be mostly greens, but once you start looking at all the different types of tests that are handled within the lab system, it then goes back to yellow. And then to note also that for 2.3, it's currently we have it in orange for rejection rates at national level, but the comments on the extreme right, we just made a comment that we do not have rejection rates for all the tests that are going through the lab systems, but if we look at EID and viral load, the rejection rate is actually 5%. So we just put that as a comment at the extreme end. And then for sample transportation, again, we are on orange, and even though most of these facilities are now linked to a transport, specimen transport network, we realize that the frequency is still sub-optimal, and we need to that frequency as well as the coverage. So in short, I think that's how our results are looking like based on the scorecard. So the orange and the light greens, the yellows would be areas that we need to put some more work into. On result utilization, we also need to put some more work into it. And then going to the last domain, which is the national statistics on viral load testing. As I mentioned earlier, this is one of the domains where we had the most challenges because some of the data that is required was not available. But I'm glad to say for this quarter, we did, for this year, we did have more data than we had in 2017. So number of labs currently carrying out HIV viral load testing, we have 14. And then the testing capacity is estimated to be around 870. And then tests done in the last 12 months, last for 2018, we had 521,000. And in terms of companies where we have reagent rentals, we have Abbott, Roche, and now we also have Hologic. Then the number of people living with HIV, it's at 1,325,000. A number on art is 1,150,000. And then people living with HIV on first-line regimen, it's 1,113,000. And then routine viral load tests, those that are eligible for routine viral load tests, it's 1,150,000. And to note that we're just using the number of people that are currently on art as our need for viral load, because each one of those will need to have at least one viral load test done per year. So it's a plus or minus figure, not very accurate, but that's what we are working with currently. And then for 2018, people living with HIV on art who were virally suppressed, we had 444,700. And then moving on to management of high viral load, number of people living with HIV on art with a viral load of greater than 1,000. In Q1 2019, we had 8,007. And then those who got a follow-up viral load testing within 3 to 6 months, 3,423. And then number of people who had suppressed the viral loads at follow-up testing was 1,898. And then number of people living with HIV on art with 2 consecutive viral load test results greater than 1,000 copies who were switched to second or third line art. For second line, we had 1,338. Then for third line, we had 43. Just to note that the data is for only for Q1 2019. We were not collecting this data previously because of the M&E systems. So data collection started in January 29. So as we move forward, we'll be increasing the time period as we collect more data. And then just to see how representative of the National Viral Load Program these results are, like for the result utilizations, like I mentioned, they are from Q1 2019, and they are nationally representative. These were pulled out of DHIS2, and according to the Q1 report, 97% of the sites submitted their DHIS2 monthly return forms. And then, like I mentioned, data collection commenced in January 2019, so only the first quarter is analyzed. Moving forward, how do we intend to use these results to improve viral load program? The long and short of the answer is that is to close the gaps that have been identified which include demand creation activities at facility level to improve uptake and coverage of the viral load services, then to increase sample transportation logistics so that again coverage and results turnaround time are also improved, then to increase facility mentoring regarding result utilization and documentation, because along the high VL cascade, you notice that at each step we were losing patients. So result utilization definitely also needs to be improved. Then to improve availability and use of standard M&E tools for viral load, e.g. the high viral load registers, and to ensure that all the viral load testing labs have LIMS so that data quality is also improved. The key challenges, like I mentioned, it was inadequate data and then interpretation of some domain questions and scoring, especially for combined questions. So one of the things that we noted on the scorecard is that some questions are actually two questions but combined into one. So you have a scenario where you partially meet one question, like you meet the requirements of one question, but you don't meet the requirements of the second question. So automatically that means you are going back to the previous scoring. And then also the temptation to look at viral load and EID testing systems only, while some of the questions require scoring based on all the lab tests. And then just looking at a comparison of the 2017 and 2018 viral load scorecards. So if we look at last year's scorecard, you'll find that we had more greens than the current one. And this is due to the improved understanding of scoring criteria and objectivity based on feedback given to the country team. Like I mentioned, we had discussions on how we are supposed to be completing that scorecard and what each of those questions is actually asking for. And then the other, I think, a major improvement is that for 2017, Domain 7 didn't have any data. For what we've just done now, Domain 7 now has more data. We still have some data that is missing, but definitely it is improved. So our data collection tools for DHIS2 were amended to start capturing data on viral load after the last meeting in October. So thank you very much. In a nutshell, that has been our experience with the viral load scorecard.
The first presentation by Gesh. I think we have some good insights in what is expected of us in the next 1 month. We are going to require every country team to turn in their assessment report after you filled the form, give it back to us ahead of the face-to-face meeting that is going to run in October. So we need it by end of August so we can also look at the data, analyze it, and make it ready for that meeting for us to make sense of what we are seeing with the country program. Norah, thank you very much, and your team, you did a great job. So we have less than 10 minutes to address any questions that are there. Please, I would ask somebody who is in charge of the chat to actually get us back to the chat, get the questions quickly, and let them be given address to the people who have been presenting. We have about 5 minutes, 6 minutes, yeah.
Okay, thank you very much, Dr. Charles, and all the presenters for wonderful presentations. We have only one question in the chat, but I'll request members, if they have any comments or questions that they would want to verbally say out, you can raise your hand, and then the moderator will give you a chance to ask or to comment about the tool. The question that we have in the chat is from NHRL, that is from Kenya, and it says, I didn't get the results on the viral results utilization. Was it covered? They didn't get the results on viral utilization. I think that is in the assessment tool that was filled in by Zimbabwe. They're asking, was it covered? Norah?
Yeah. Yes, we did cover results utilization. Because of time constraints, I couldn't show the whole scorecard, or I could not go through the whole scorecard. So I just showed screenshots for some of the domains. But yes, we did cover results utilization, and we do have some areas where we need to improve. We had some yellows and a few light greens. I don't know if that is if that answers your question. Oh. And also the last slide where I was showing the statistics, it does include viral load utilization as well.
Okay, thank you very much. The other question is from Anafi, and he is asking, can you give a rough ride on how much time is required to complete the scorecard? Once again, can you give a rough ride on how much time is required to complete the scorecard?
That's a difficult one, Anafi. Like I indicated, it covers the whole cascade, and you are pulling the data from various sources. What usually helps, if you want to reduce the time, is to kind of assign people to work on the different sections and put in the data that they have based on their areas where they normally work. Like if it's the M&E piece, to ask the M&E group to fill in that section in advance, so that when people then sit down, they are going through the data and then interrogating to see whether it's representative of the whole country, and also whether it applies. Like for some of the domains, you may find that for result utilization, some partner may report very good results because that's the situation in the particular district where they're working. But once you start gathering information from the rest of the districts, you then realize that the average may be actually lower than what has been reported. So it's difficult to give time. In our case, I think we had maybe 3 or so 2-hour meetings to go through the scorecard.
Okay.
Thanks, Norah. I think
okay,
maybe
thank
just
you very much.
Okay, so is that the set of questions? Anafi, you wanted to say something? I have, hello?
Okay, maybe I have one more question for Norah and the Zimbabwean team.
Can you hear me?
Yes, Anafi, we can hear you.
Okay, thanks. No, I just wanted to say, I think that question for Norah is very relevant to all of us, given that the face-to-face meeting, I think, will be in about 2 to 3 months' time. So taking cognizance of how much time for country teams to start this as early as possible. I think that's what I wanted to just give that as a message to fellow colleagues on the line.
Okay. So mention the last question, Nicholas. You said you have a question?
Yes, I have a question. Norah, how did you overcome to either overscore or underscore yourself? Because looking at how you've scored, I know as human beings we have tendencies of wanting to overscore ourselves in several instances. And I think that somehow affected us last time. But based on what you've done, the tool you filled in looks so what advice would you give to the other country teams in order to overcome forwarding or overscoring themselves? Thank you.
Thank you, Nicholas. I'll ask one of my colleagues, maybe Chieza or Cabo, to respond to that one. Or
okay, thank you. Bobby here. I think I just typed up a response to say it's really an iterative process, and you need to establish consensus with all the stakeholders. It takes some time, and I think what helped our team was thinking about where we are in terms of performance, whether there are still gaps. So if everybody in the meeting or who is scoring agrees that that particular section of the scorecard still needs some work, then definitely you default to the previous grade that you had given yourself. So for example, some people will say light green, we're on light green, some people will be yellow. So thinking about what our coverage is, thinking about what our viral suppression is, turnaround time is, once we have those objective measures, I think they help kind of establish a consensus in terms of where the country is on a particular section. I hope that's helpful. I think keeping quantitative measures in mind as you try to rate yourself is very helpful in keeping things in perspective.
Okay. Thank you very much. I think with that,
someone has a brief question, I think, about the first meeting. That's Edu9. I don't know.
What is the question?
Yes, Ed, you are unmuted. Can you ask the question you wanted to ask?
Okay, hi. This is Karija Jallo from CDC South Africa. I have a comment about the meeting. Charles, did you say the meeting is the second week of October?
Yeah, the second week of October, yes.
The comment I have about it, I don't know, for those who are sponsored by PEPFAR, you know, the beginning of the fiscal year is October 1st. Usually in October, there is not much money in the countries. If we want to see people, we are kind of limited because the OGAC money hasn't arrived in country yet. I don't know if that's the experience for other people. Is there a way to push it at least in the last week of October?
Okay. Thank you for bringing that up. We will take it back to the core team and we agree. But that is a very genuine concern and we will have to discuss it. We will find a way, we'll chat a way forward. Yeah, thank you very much for all the discussion and the presentations that have been made. And I want to thank especially the Zimbabwe team for being as objective as possible in filling up the chart and also filling up the last column where you put the comments that indicate why you have preferred that score. That is very important, even as we make the analysis of the data, to be able to analyze it objectively based on those comments that you put up there. Make sure you put a comment to indicate why you have decided to use that score. And also know that this is an advocacy tool. It's not like an audit process. We are not looking for right and wrong, but we are just looking for a way to look at things the way they are. And then based on the what the picture is, we can use that as a tool to advocate to be able to fill up the gaps. So let us continue to discuss on WhatsApp. I know there could still be more questions that will come. And then we are going to be sending you the tool. By tomorrow, you should have the tool. And we give you precisely 1 month. By the end of August, all of us should have turned in our tool when it is already filled. Because the team that is going to analyze it, analyze for all the countries, will need the month of September to do that. before the meeting comes in October. But as the concern has been highlighted for the PEPFAR team, we will have to discuss it with our other colleagues and agree as to whether we push it towards the end of October. Otherwise, thank you very much. Before I end the call, I'm sorry that I'm going to pass some news that may not be very good here at this moment. I got a message. I sent out a message asking all country teams to be online, but I got a message that we have lost one of our ardent members, Mr. Alwin Mbeni from Malawi. The one who has been leading the Malawi team died yesterday in an accident.
Oh.
And the Malawi team has not been able to be online. That message has been relayed by Brown, Chuandira. So it is really bad news. And as we are a community, you can pass a message of sympathy to the team in Malawi and to the family. They have informed me they are at his home at the moment. So it is really bad. One of our ardent members just passed on like that. So sorry, the hearts get heavy, but this is life. We face it, it is hurting, but sometimes some of the things do happen. So have a nice time, wait, and we send you the tool. I would want to close the session, unless if somebody has anything to say before I do. Okay, I'm sorry for passing the news, but I didn't want to stop the call before I do, because they sent the message while we were on the call. Otherwise, please pray for the family and encourage them. Thank you very much. I end the call.
Thank you.
Bye-bye.
Thank you. Bye-bye.
Bye.